All right. Hi, everyone. Welcome to my presentation. My name is Sabrina Magnus, and I use she, her pronouns. I am a queer person of mixed settler ancestry with British and Scottish roots on my mother's side and German Jewish roots on my father's side. I was born on the unceded territories of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam nations, and I have spent around half of my life overseas, mostly in Portugal, Spain, and the UK, and I've only recently moved back to what is now known as BC. So, in the spirit of truth telling, I acknowledge that I am an uninvited guest living on the traditional and unceded territories of the Lekwungen peoples, the Esquimalt and Songhees nations. I recognize with gratitude that the people of these nations are the rightful caretakers and stewards of these beautiful lands and have been since time immemorial. So I had the privilege of completing my practicum with the Foundry West Shore Souk and Port Renfrew, whose mission is to support young people in living a good life. This center is currently in the development phase and plans to open their doors in the West Shore of Greater Victoria soon. This Foundry is part of the province-wide Foundry BC initiative and provides integrated services for youth ages 12 to 24. Their model includes bringing together health and social services that already exist in the community into one welcoming, accessible space. Their vision is all of a young person's care providers communicating and working together, replacing siloed services with wraparound support for both young people and the people who love them. The Foundry offers low barrier access to physical and sexual health care, mental health services, substance use and harm reduction supports, youth and family peer support, social services, and Indigenous health services. So because the project was in the development phase, my role was dynamic and I was able to work on a range of projects. My area of focus in the BA program is Indigenous health. So my primary focus was helping the Foundry to prepare for Indigenous engagement. I also had the opportunity to attend and co-facilitate 2 youth advisory circle meetings, which is a group of young people that advise on organizational decision-making from a youth perspective. I gave a presentation on the importance of land acknowledgements to them, led a follow-up discussion, and facilitated a community asset mapping activity. I was also privileged to observe and participate in relationship building meetings between my supervisor and various community members. My main project was creating a 25-page policy document entitled Wise Practices in Indigenous Engagement. I was incredibly intimidated by this task at first, and as a non-Indigenous person, I initially felt uncomfortable taking it on. I sought advice from Indigenous mentors, and they told me that if there can't be an Indigenous person there to do the work, then it is my responsibility to step up as an informed ally. They reminded me that while I may be advocating for Indigenous people, I am never speaking for them. I conducted a literature review and made sure to draw only from Indigenous sources. Then I compiled a briefing note and a full policy document, which included organizational values and responsibilities to Indigenous communities, guiding principles, recommendations for building meaningful relationships, and a table of locally relevant information and contacts for local First Nations and Indigenous-led and serving organizations. I also created a courtesy presentation that introduces the Foundry and outlines their services and commitment to collaborative partnerships. This will be shared during initial meetings with local First Nations and other Indigenous community members. I want to highlight 2 PHSP values that guided me throughout my practicum experience. First was building partnerships with people and populations served. I had the opportunity to connect with a diverse range of community members and witness partnerships forming in real time. It was powerful to observe people realizing their values and goals were aligned with ours, and it showed me that change happens when passionate people come together. Second is diversity and cultural safety. As a non-Indigenous author of an Indigenous-focused document, I approached this work with cultural humility, engaging in deep self-reflection before and throughout the process. PHSP knowledge areas in action. So throughout my practicum, I saw firsthand how effective multidisciplinary teamwork improves equitable, person-centered service provision. The Foundry model is inherently collaborative, and brings together diverse professionals and community members to provide wraparound care for young people. A key focus of Foundry is improving health and reducing health inequities in communities, which is achieved first by integrating culturally appropriate health services for Indigenous youth, and doing so through direct collaboration with local Indigenous leaders, elders, and knowledge keepers. Second, by amplifying community voices, in particular the diverse voices of local young people. And third, by prioritizing low barrier access to life-saving and life-promoting services. Truth and reconciliation. So I also chose to highlight call to action number 22, which states, we call upon those. Oh, headphones just died. Hope everyone can you still hear me? Okay. We call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders. So as a queer person, I deeply understand the value of allyship and how easily it can become a performative role. So with eyes wide open and an understanding of the continual work and reflection it takes to be an informed ally, I make the commitment to amplify Indigenous voices when they are present and to advocate for their inclusion when they are not. I acknowledge that equitable and culturally appropriate care can only be realized through collaboration with Indigenous people themselves, and I'm committed to fostering these relationships. I am also committed to lifelong learning and critical self-reflection, acknowledging that change happens when we embrace continual growth. So my highlights and reflections. First, the highlight of my BA experience was learning through an Indigenous lens, and I want to take a moment to honor that. This experience has been eye-opening, humbling, inspiring, and incredibly meaningful. I've found that my way of thinking has become more relational. I'm more intentional in how I interact with the world around me, careful about the words I choose to use, and aware of the generational repercussions of the decisions I make. I plan to hold these teachings close to my heart and take them with me into my future as a public health professional. Second, this past year, I was really privileged to work with the Fireweed Project, which is a research initiative focused on Indigenous peoples and the right to abortion. It has inspired me to seek out future work in research and to use my voice to speak up for reproductive justice and culturally safe care. And I'll pop the link to their website in the chat after, if anyone's interested. Third, it was really wonderful to go out into the community and meet people working in various health and social service roles. Fourth, guided by the wisdom of my supervisor, coworkers, and those I met in community, I learned to really trust my knowledge and experience and felt confident applying them in my practicum work. Lastly, this work reinforced the importance of reciprocity and that it truly takes a village to provide equitable services. So a huge thank you to my amazing and supportive supervisor, Kathy Easton. Thank you for trusting me with important work and for including me in everything you thought I could learn something from. Thank you to Thrive Social Services Society for being Foundry's lead agency and supporting us in our work. Thank you to the Fireweed Project for including me in something so important. Thank you to Dr. Skaya for your unfailing support and for always being available to help us. Thank you to all of our wonderful PHSP instructors for guiding us these past few years. And finally, thank you to my classmates, particularly my repeat project partners. I appreciate you. Congratulations, everyone, for reaching the finish line. It's a pleasure to be here with you.